Hello, and welcome to Identif Healthcare Solutions webinar, using NextGen to capture social determinants of health and why you need to start, like right now. My name is Chelsea Grover, and I'm the Marketing Communications Manager for Identif. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded, and they'll send out a copy of the slides along with the recording within the next week. Next, I have some super exciting news to share with you all. Identif is now part of DAS Health. DAS Health is a leading provider of health IT and management solutions and a trusted consultant to many physicians groups, hospitals, and healthcare systems across North America. By combining our skills and experience, we'll be able to provide even more support, value, and solutions for your practice. We look forward to continuing to serve you. Next, I want to reassure you all that we are still here for you. As you know, we specialize specifically in NextGen healthcare. We're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have add-on productivity solutions for NextGen, including ChartCard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I wanted to share some upcoming webinars with you. On Wednesday, November 17th, we'll be presenting a deep dive into NextGen virtual visits. Then on December 8th, we're going to help you learn everything you need to know for an audit. So keep your eyes out for invitations to those webinars on LinkedIn and via email. Okay, so back to today's webinar on using NextGen to capture social determinants of health. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So, without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Holland Lively is a consultant at Identif. They're both super eager to share their knowledge with you today. So with that, I'm going to let them get started.
Great. Well, thank you, Chelsea, and welcome everyone to our webinar highlighting the importance of social determinants of health and why your practice should be collecting this type of data starting like yesterday, in my opinion. But I think we can all recognize that there has been an increased drive over, I would say, roughly around the past 18 months to collect social determinants of health data due to specific milestones that have happened in legislation. One including the proposed inclusion of this information in the USCDI data set for EHR certification, and of course, the impact we've seen of the COVID-19 pandemic. Now, in this webinar, we want to inform and provide insight on exactly where the healthcare industry currently stands on SDoH. The hope is that you can use this information that we'll present in the beginning to really gain buy-in at your practice on why collection of this data is imperative for your practice, no matter what specialty going forward. And then the second half of the webinar focuses on how to actually document this data using NextGen, and also how to incorporate other tools you may likely already have access to, such as Aunt Bertha, maybe an intake software you already have in place, or even maybe some other NextGen products like NextGen Population Health or NextGen Analytics to assist in this data collection process. So our goal is to leave you with kind of a renewed understanding of why capturing SDoH data is vital for the success of your practice, and really how to go about implementing this and starting, tomorrow if you wanted to. So our agenda today is going to be a very brief introduction of social determinants of health. Again, we hosted a webinar a little over a year ago, maybe 2 years ago at this point, that really dug into the basics of social determinants of health and what they are. Today, we're focusing on the current environment, where we're at legislation-wise and with payers, and most importantly, how to start collecting this data and addressing patient needs in this area as soon as possible using NextGen. So ideally, this presentation is going to help you do a few things. One, we're hoping it'll identify methods to understand the unique health needs of your current patient population. Hopefully, it'll also help you actually formulate a plan to help your practice begin collecting this data. And then hopefully explain the different tools available to screen your patients, including how and when to, and then also how to connect your patients to appropriate resources in your own community. So that's the plan. Let's go ahead and dive right into the very brief intro I mentioned / promised you all. So starting with the basics, what are social determinants of health? Well, social determinants of health are the economic and social conditions that are going to influence individuals and determine a difference in health status. Basically, they're going to be the conditions that people are born, grow, work, live, and even age in. They're that wider set of forces and systems that are shaping the conditions of your daily life. And then if you look at this graphic on the screen, you can see really the 5 areas in which SDoH are typically classified. So that's going to be economic stability, you have education, you have health and healthcare, you have your neighborhood and your built environment, and then you have your social and community context. Now, if we look at examples of what's included in each of these categories, we're going to get a better understanding of what the specific determinant really includes. So let's start with economic stability. I think the obvious ones come to mind of employment and income, but some maybe not so obvious ones, such as your expenses, your debt that you already have, maybe medical bills, but also your financial support that you have available to you, maybe from family members or friends, etc. Then you have your neighborhood and physical environment. So again, I think the obvious things that come to mind are going to be housing, but some maybe less obvious things like transportation, green space, parks, walkability, and playgrounds, and also your accessibility to transportation. Then we have education. Again, I'm going to go with the obvious ones being, early childhood as well as higher education, but you also have things like literacy, language, and even vocational training or trade skills. Food is pretty self-explanatory. You have hunger, and then also access not only to food, but access to healthy options, affordable, healthy options for food. And then community and social context. So this is going to be things like community engagement, your social integration, your friends circle, your support system around you, as well as discrimination. And then healthcare system. So this is going to be access to a healthcare provider and their availability, but also the quality of that care, as well as the provider linguistic and cultural competency in that area. If they have an interpreter on hand, if you're able to understand what's happening with your healthcare literacy, things like that are under there as well. So over the years, how key areas of social determinants of health are defined and the number of key areas identified by public health organizations and initiatives. Think the World Health Organization, think CDC, think of the initiative, Healthy People 2020, or known as Healthy People 2030 now, have evolved. And with that evolution, we've discovered how these determinants impact an individual's health and to what degree. So you can see in this graphic how large of an impact things like social circumstances combined with environment play in a person's overall health, and how those two combined is just about even impact-wise if you were to combine medical care and genetics, which years ago were thought to be the only driving forces in a person's health. So this research is really what solidified the concept or the saying I'm sure almost all of you have heard when it comes to talking about this topic, that upstream determinants or social determinants account for 80% of health outcomes, whereas only 20% of health outcomes are a direct result of medical care or what we call downstream determinants. Now, I want to take a look at what we mean by upstream versus downstream because it is pretty common terminology surrounding this topic lately. Public health in general has notoriously focused on the downstream factors you see on the right side, like disease, injury, mortality, even risk factors that I know we all screen for and document for. So think like smoking, alcohol, or drug use. But what social determinants of health and the shifting healthcare landscape is having us do is focus on more of those upstream factors that determine health. So the traditional ways of identifying a true complex patient is still grounded in the downstream medical model. We're going to look at things like number of chronic conditions, their health outcomes, maybe even their hospital or ED utilization. But because the social determinants of health influence these downstream factors, the industry is actually starting to shift to include them and how providers identify and treat their complex patients. care teams are actually realizing they have to have some sort of understanding of their patient's complexity, both clinically but also non-clinically, in order to actually make an informed care decision that's going to be patient-centered and also provide interventions that are much more appropriately tailored to the patient. So kind of as a quick recap, downstream is going to refer to typical clinical care factors. Think health conditions, risk behaviors, and diseases. Whereas upstream is going to refer to things like socioeconomic conditions, environmental conditions, and things like social context. So as an industry, we're seeing a shift from downstream to focus on upstream. Okay, I think I kept my promise. That was pretty quick, at least pretty quick for me. If you've been on my webinars before, I can get a little carried away. So now that you have that kind of quick recap on what social determinants are, let's look at the current landscape surrounding this topic in healthcare right now. So first, let's look at the various pieces of legislation that have come through Congress in some way, shape, or form since the last time we had this webinar. I count, I think, 16 in total different little tiles or variations of legislation related to the promotion of social determinants of health in just under, I think this is probably 2-3 years at this point. You know, that's almost one bill every 2 months being introduced to Congress and gaining sponsorship. That is crazy when you think about where this topic was 5 years ago. Clearly, this is gaining some political support and buy-in and is a great indicator that something could be coming down the road to possibly mandate the collection of this data or even incentivize it in some way. To kind of further support that idea, one thing that's not listed on here that in my opinion was a huge step forward for this type of data was the inclusion of SDoH data in the USCDI dataset version 2 that was announced July of this year. This is huge because it means for EHR certifications going forward, all certified, let me clarify, certified EHRs will have to have the functionality to support the collection of this data moving forward. Now let's look at the two, I would say maybe not most recent pieces of legislation, but for this year, maybe the most impactful pieces of legislation that were introduced to the House in 2021. The first being the Improving Social Determinants of Health Act of 2021. I won't say it's their best work of creative genius on the title, but you get the point. Typically they throw in a pun, which I do enjoy. But this bill was introduced in January of this year. It's currently referred to the Subcommittee on Health within the House Committee on Energy and Commerce. Now, as written, the goals here are to improve health outcomes and reduce health inequities through the coordination of SDoH activities, also to improve public health agencies and community organizations' capacity to address SDoH in communities. Now, the proposed bill would work to ensure the CDC considers and incorporates SDoH grant awards. It's going to award grants to local, state, territorial, and tribal health agencies and organizations. It'll also work to award grants to nonprofits and nonprofit institutions of higher education to conduct some sort of research on best practices. It's going to try to coordinate, support, and align CDC SDoH activities with other federal health agencies, think HHS and CMS most likely, and then it's going to try to collect and analyze data related to SDoH. So this would all be made possible through the $50 million proposed to be appropriated to actually fund this program. Now, again, this isn't finalized by any means. It is still proposed and kind of with the committee right now. But currently, this bill itself has about 481 supporting organizations, and that number may have grown since I looked last. So it has a lot of support right now. The second bill introduced this year is the Social Determinants Accelerator Act of 2021. This was introduced to the House in April of this year. Now, the last action was actually in July. After amendments were done by the subcommittee, they were sent back to the full Energy and Commerce Committee within the House. So this bill seems a little bit farther along. Now, the purpose of this bill is to really assist state and local and tribal governments in improving health and social outcomes. for individuals and the ROI for health and social services programs. So it's going to do that by establishing effective technical assistance in some way, try and create some sort of pipeline of state and locally cross-sector strategies that are going to actually, generate some sort of evidence about their impact of these programs. They're hoping to enlist state and local governments and various service providers as partners in identifying federal, statutory, regulatory, and admin challenges. And then they're also going to look at things like developing strategies to improve health and social outcomes without denying services or restricting eligibility for certain vulnerable populations. And it's going to do this by establishing some sort of interagency, intergovernmental technical advisory council. It's going to be known as the Social Determinants Accelerator Interagency Council. Again, not as creative as usual, but they would have a large range of functions. Some of those would include making recommendations to the HHS secretary and the current CMS administrator for certain criteria for making, maybe grants or award money. They're going to try and provide targeted technical assistance to states who are developing social determinants accelerator plans. They're going to seek feedback on how to improve the technical assistance. They're going to solicit applications for grants. They're going to coordinate kind of other relevant cross-agency initiatives, et cetera. So a lot packed into this bill that they're trying to get accomplished here, and they have great plans. So both of these are still kind of sitting in the House right now. The last action on either of these was around summertime, but we should see more of this pick up here soon. But what else besides legislation has actually been finalized that would matter when it comes to social determinants of health? So one thing comes to mind immediately: money, funding or reimbursement for collecting this data and or providing services related to it. So let's start with the nation's largest payer, who usually sets the tone for all payers. So in January of this year, CMS came out with a new plan for social determinants of health under Medicaid and the CHIP program. The announcement actually stated, with the release of today's SDoH guidance, CMS acknowledges that an understanding of the social, economic, and environmental factors that affect the health outcomes of Medicaid and CHIP populations can be an integral component of states' efforts to realign incentives, reduce costs, and advance value-based care in health systems. So now states have the flexibility to design an array of services to address social determinants of health. So the services and supports that states can really cover, they're going to vary by each one, but they do tend to fall within several categories of services. So we've seen housing-related services, we've seen non-medical transportation, we've seen things focused on home-delivered meals, educational services, and other things like employment, or even things like community integration and social supports as well being put in place. Now, on the other side of the house with Medicare, MA plans are actually now covering benefits that address social determinants of health as well. So as we know, Medicare beneficiaries enrolled in Medicare Parts A and B can actually choose to receive their benefits through a Medicare Advantage plan. So MA plans must cover the benefits that a fee-for-service Medicare covers, but they can offer additional benefits beyond that traditional coverage, known as supplemental benefits that they get reimbursed for. So among those supplemental benefits, CMS actually allowed MA plans to offer, in previous years, I'm talking not before 2019, but 2019 and 2020, they were allowed to offer things like adult daycare services, home-based palliative care, in-home support services of some kind, transportation, and then they did offer home and bathroom safety devices. This year, CMS added even more to the list for MA beneficiaries. So they've expanded the meal delivery benefit as well as the transportation needs. They've also included transportation for things like grocery shopping, as well as expanding the home environment services that are covered too. So in a press release, CMS really gave the example of an MA plan covering, for instance, home air cleaners or maybe carpet shampooing for someone with asthma, because they could reduce the irritants that would trigger an asthma attack. So you get the idea here. On both sides, Medicaid and Medicare, definitely expanding services and supports that are covered by these programs for patients. So if the nation's largest payer is providing services and supports related to SDoH, are we really surprised commercial payers are following suit? I was not surprised that they had. This is usually how it happens in the industry. However, I was surprised at how many insurers had some sort of plan or taken some sort of action towards supporting the promotion of SDoH. And this video is not meant to make you dizzy in any way. It is truly just to show you the sheer volume. When I started putting this together, I was actually overwhelmed. I didn't even know where to start. I was going to start pulling examples to put on a slide, but I just decided to record my screen so you could see how long I scrolled to get to the bottom of this. I mean, we're on the C's right now. So hopefully this reinforces the idea that, hello, everyone is doing this. You know, the time is now to get started, because if you wait any longer, you're going to be behind. Legislation and payers are usually the first ones to take some sort of action, and then it usually leads to something that's either required for providers or incentivized. Cough, cough, meaningful use, MIPS. We've seen this trend in the past. So in conclusion, payers and providers are now really realizing that assessing people in a more holistic way can actually make a huge difference in the health and well-being of an individual. And to that end, SDoH are becoming as important as medical record information itself is really what we're seeing here. And last, but certainly not least, is the impact the pandemic has had on this topic as well. Everyone's talking about how COVID forever changed the game when it comes to telehealth, but it had a similar impact on social determinants of health as well. We learned very quickly that many social determinants of health, including poverty, your physical environment, and either race or ethnicity, can have a considerable effect on COVID-19 outcomes. Really, the pandemic exposed many challenges in the nation's healthcare system, and among them, the need for more reliable data to better understand the public health needs of all Americans. And not only that perspective, but also looking at those who maybe lost their jobs and now find themselves in need of social determinants of health assistance that never have before. You can see in the graphic on the screen here for data, including the most recent period, which is September 1st to September 13th, 2021 is what we're looking at. This shows that right now, more than 1 in 6 adults reported that they or someone in their household lost their job or their income. More than half of adults reported difficulty paying for usual household expenses. 5% of adults had no confidence in their ability to make next month's housing payment, and 8.8% reported food insufficiency in their household. So not only did COVID, shine a light on existing SDoH and their impact on health outcomes, but it also catapulted a lot more people into a place where SDoH may now have a negative impact on their health and they may need some sort of assistance. So I don't know about you, but I am convinced you need to implement collection of this information from your patients starting today. Now, I may be a little biased, but you're all muted, so you can't exactly argue with me. So where should you start as soon as you hang up from this call? Well, I would start by looking at these 8 steps. And no, I did not make them up. The American Medical Association did, so they're legit, and if you disagree with them, take it up with them. But according to the AMA, you should begin by understanding your community and its needs. The next step is always going to be typically engage your key leadership. You want to do that as soon as possible to gain that buy-in, which was kind of the whole purpose of the start of this PowerPoint, was to give you the information and tools you need to gain that buy-in and prove its importance. Then you're going to assess your practice's current readiness to collect this data. Go ahead and select and define your plan to implement this. Then you're going to actually assess and collect this data at the patient level, and then take it a step further. Once you've collected that data, start linking patients to actual SDoH resources in your community. And once you've done all of that, take a step back, evaluate and refine the process you put in place, and then of course, celebrate your success. So if we look at step 1, begin by understanding the health needs of the communities you serve. So likely you've already seen the impact in some way, shape, or form SDoH has had among your patient population. Now, to formally start this, a good place to start is actually reviewing what's called your local community health needs assessment. If you haven't heard of that before, the CHNA. So, because I didn't know about this before my research on this, but federally tax exempt hospitals are actually required to conduct a CHNA every 3 years. So, and hospitals typically collaborate with some sort of local public health departments and seek some sort of community input to conduct this report. And it's actually posted on each hospital's website, and it includes information about the population it serves. It identifies disparities for you, and it'll actually prioritize health issues of concern for you as well. So if you're in a community practice with patients seeking care, maybe across multiple hospitals, or you have a main hospital that they typically go to, you want to look at that specific hospital's CHNA report or sample a few CHNA reports to further define your patient population's needs. So this assessment can typically easily be accessed online by typing in, your local hospital's name, followed by community health needs assessment into Google, any sort of search engine. So in my opinion, a relatively easy step one, you could even be doing that right now or right after this, since you're likely hanging on to my every word over here. But once you do that, it is a very easy, I would say, low-hanging fruit to complete that first step and then figure out what has been identified already in your certain community of what's needed. So step two would be engage your leadership. Support from key leadership. So I do mean the C-suite. If you're a large organization, think CEO, COO, or your chief medical officer. That's what's recommended depending on your size. That executive leadership is going to provide the necessary financial, maybe staffing resources to implement any sort of program or initiative. And they can also assist in removing any admin or logistical barriers you'll come across. Now, on a smaller scope of intervention, think individual department, maybe within a larger institution, maybe look at securing the support of the department chair or your operations manager. Or even for maybe an individual practice location, seek the practice manager's buy-in. Many practices and health systems have seen the positive impact of addressing SDoH, both financially and in terms of patient outcomes. So I say financially because I think calculating the return on investment or ROI for your specific intervention can absolutely enhance key leadership support and provide a sustainable data-driven approach for you to put in place. So one resource to help actually evaluate the impact is the ROI calculator for partnerships to address SDoH. It was created by the Commonwealth Fund. You can Google that and it'll come right up. It does require very specific data to be inputted for it to work, but this is a great tool to start engaging leadership and start that conversation. Next, you'll want to assess your readiness to implement. Now, by understanding the available resources, within your organization, you're going to be able to select the appropriate initiative. So you want to look at, your gaps in processes. Does your practice have the infrastructure to implement a specific program? Your financial needs, what financial resources are available for your practice, maybe at the community or state level to support initiatives like that. Staffing needs. Does your practice or organization have the personnel on hand to start this? Is there more specifically a champion who can help spearhead this project? And then existing supportive resources. So does your, like I said, community, your region, or your state government have any existing guidelines or resources or even funding to help kickstart your project? And then once you've done that, how can you really tell if your organization's ready to address social determinants of health? 3 things: focus, assess, and review. Again, when it comes to focus, maybe start with one priority patient population that you currently serve and maybe one health-related social need that's going to impact that population. Examples that come to mind would be adults with diabetes, with food insecurity, maybe children with asthma who have substandard housing, things like that. Then assess, again, keeping that specific population and that specific social need in mind, assess your capability as an organization, like we just mentioned. And then finally, review. Reflect on this assessment and your areas of strength and maybe opportunities for improvement. This is going to help your practice determine where to begin. So, for example, suppose your CHNA identified obesity as an area of need, and your state's actually already focusing on healthy lifestyle initiatives to reduce the incidence of obesity, and maybe they're providing funding for that. In that case, this assessment is going to determine that an intervention focusing on obesity is a great place to start based on existing resources, support, and funding. Now, select and define your plan. Again, these are just guidelines. AMA recommends, picking a specific social need, choosing a health outcome to track, and defining that target population. This could just be as simple as starting to collect any SDoH data and going from there. You do want to consider what type of practice setting you're in. Looking at some of the attendees on the call, we do have a mix. Are you just a physician practice? Are you considered an FQHC, a federally qualified health center? Are you a larger or part of a larger hospital or health system? This is going to play a key role in determining the size and scope of the project implementation. There are going to be many different ways to address the collection of SDoH data depending on your size and capacity. For example, a small practice might just screen for SDoH and then refer patients to community orgs for assistance. A larger practice might actually employ maybe a social worker or some sort of community health worker to navigate community referrals for their patients. And then maybe even a next level larger org that's maybe affiliated with a hospital or an academic medical center could have the ability to screen, refer, navigate, and even develop new services for the community. Based on our client base alone, we have clients who are just tracking this information from patients and collecting that in the system. Maybe they're using a free tool to provide recommendations on community resources. But on the flip side, we also have clients who offer a discounted rate grocery store at their location on site. We have other clients who are offering free legal services on site for patients who maybe are having issues with housing, so they have someone to represent them at no cost. So we do have clients, kind of representing a broad spectrum of services and what they're able to provide for social determinants of health currently. Now, once you have your plan in place, the next step is to actually assess or collect this data at the patient level. So this process is going to be recommended, regardless of your practice setting or regardless if you selected one specific determinant. Just start collecting the data and incorporating that screening into your workflow, because you'll quickly begin to understand what's important to the patient and identify social determinants that may be impacting your patient population in the community. So here on the screen are some common free screening tools for care teams. The first one's Prepare, which we'll talk about later on because that's actually what NextGen uses. There are other ones such as Siren. This is going to be a very widely used social health screening tool that looks at things like needs questions, but it looks at reading level and education and other things as well. You have the Everyone project that was actually created by the American Academy of Family Physicians. It's more of a toolkit. It's going to include screening questions in that toolkit, but it'll also include a description of maybe a team-based approach for screening for SDoH and other resources in there. You have the AHCM. This is the Accountable Health Communities Health-Related Social Needs Screening Tool. Very long name, not shocked that it was also developed by CMS. So again, this is a screening tool that really looks at 5 different domains. And then you have OCHIN, which is the Oregon Community Health Information Network. This is a little bit different. It is kind of a flow sheet that was created to facilitate this information. It is patient-reported information to include in the EHR as well. The next step after screening patients is going to be to actually link them to community resources. So once you have the patients who have unmet needs, your next step is to actually link them to appropriate resources. So you can provide a patient with a list of resources. That's very beneficial. You could also take a more active role in arranging a resource alongside each patient and following up to ensure that they access that resource. Some examples of resource connections might include referrals to local food banks or food pharmacies, maybe vouchers for the bus or subway transportation. Again, that's more extended if you have a relationship of some sort in place with transportation services, maybe providing a mobile food pantry at your clinic location. But you have to think about how this could actually be accomplished in the practice setting. So there are some free resources that you can take advantage of right away. So there's Aunt Bertha, which we'll cover later on or in a few slides here. And there's also this 211 Essential Community Services Program. With that, you just simply dial 211 and you're routed to a referral specialist who can actually match you to available resources. And oftentimes actually make a direct referral to an organization to provide assistance. And this should be available throughout all of the US. Step 7 is going to be evaluate and refine. Throughout this process, it's important to refine and enhance your workflows, discuss with your team and your patients to learn, what's working or what needs to be changed. Maybe you discover your screening method isn't occurring as consistently as it should. Examine the process. See if you can identify a better way to screen more patients. Maybe the solution is as simple as training one extra staff member on administering the questionnaire during rooming, or maybe it's utilizing patient portal forms prior to the visit. Always be open to feedback and reviewing the process that you have in place to make it better. And then last but not least, celebrate your success. As you continue to refine your workflow, celebrate your successes. Share patient stories and best practices with colleagues across your practice. Sharing these stories could likely inspire other practices to implement this same model. It'll also help gain buy-in across the practice and really highlight the importance of this for your patient population, and why and how this is improving the health outcomes of the patients that you currently see. So you may be asking yourself, if we want to start this ASAP, Lindsay, how do we document this in NextGen? You've been talking about this introduction and why it's important, but let's get to it. And my answer to this is that's a great question. And my colleague Holland would love to address that for you. So I will actually hand it over to her to take you through the documentation of both what I call phase 1, collecting and screening patients using NextGen, and then phase 2, connecting patients to community resources and documenting that you did so in NextGen itself. So Holland, it is all yours.
Great, thank you so much, Lindsay. So let's take a look at phase 1, or using NextGen to collect that SDoH data. So the most familiar place to document social determinants of health data in NextGen is in your histories template. Upon scrolling to that social history panel, there actually is a link that's going to take you to a secondary social determinants of health documentation point. You can see it right at the bottom of the screenshot up there in our slides. But here you can note patient data that's going to include things like financial resources, stress and depression history, social connections, and any exposure to violence. Upon completion of all of the required fields, a total score is going to be calculated and a severity or interpretation is going to be generated. So this is something that can be reviewed at every office visit and updated accordingly by your staff and what kind of processes you agree upon. So the link to complete this information is readily available now for your staff to start using as soon as today or tomorrow. So there is another tool that some of you may be familiar with, and that is the Prepare template. So before we take a look at what that is and how it functions within NextGen, let's take a step back and go over the background and the fundamentals of what Prepare is. So Prepare is the protocol for responding to and assessing patients' assets, risks, and experience. It's a standardized patient social risk assessment tool consisting of a set of national core measures, as well as a process for addressing the social determinants at both the patient and population levels. It serves as a national effort to help health centers and other providers collect the data needed to better understand and act on their patients' social determinants of health. So by using Prepare, providers can better target clinical and non-clinical care, often in partnerships with other community-based organizations, perhaps, to drive care transformation, delivery systems integration, as well as improved health and cost reductions. The Prepare assessment tool consists of a set of core measures and optional measures. And so to accomplish these goals, it's important for all users of Prepare to collect data on all of the core measures of the Prepare, for data to reach critical mass and be strong enough to paint a full picture of the socioeconomic challenges that patients face across the nation. So it's going to align with national initiatives prioritizing the social determinants of health, such as like the Institute of Medicine's recommendation, Healthy People 2020 or now 2030, as Lindsay mentioned earlier. Measures proposed under the next stages of meaningful use, clinical coding under ICD-10 codes, and even health centers' current federal reporting requirements, such as like UDS. So the assessment tool, as it stands, is a standardized two-page form of some yes or no questions of social determinants that indirectly affects an individual's health. It will be a predicator for poor health outcomes, and providers will be able to better target clinical and non-clinical care. So Prepare measures are mapped to ICD-10 codes, link codes, and SNOMED codes in our Prepare data documentation and codification file to further standardize data for aggregation and analysis. So many of the Prepare EHR templates automatically map to the ICD-10 code so that they can be easily added to the diagnostic or problem list in the EHR. Prepare questions have also been incorporated into various federal initiatives, including CMS Accountable Health Communities demonstration project, along with CMS Office of Minority Health social needs screening efforts for long-term and post-acute care populations as part of that IMPACT Act. So what does this mean for all of you who are utilizing NextGen? So NextGen worked with NACHC to develop a set of templates for use in the Prepare program. They are available on the Success community, and NextGen has even developed a KBM integrated version of these templates for anybody who is on 593843 or higher as an out-of-the-box template. So that Prepare template is going to be accessed via the template module on the history toolbar, and it can be added as a preferred template for some easier documentation point. But upon opening the template, you're going to see questions prompted by the Prepare template for you to answer. So above is a great snippet of what that template may look like in your system. And as you can see, there are questions in different categories for personal characteristics, family and home, money and resources, barriers to care, social and emotional health, as well as some optional confidential and non-confidential questions. So a great thing to note is that if your practice plans to take that 6/2021.1 upgrade, or when your practice plans to take that upgrade, there are some changes that were made to the Prepare template. So again, that spring release is going to allow for practices to configure up to 5 customizable practice-defined questions. That configuration is going to take place in the system practice template, and we're going to be sure to show you that feature today. But what could these 5 customizable practice-defined questions mean? A great example of how you could begin utilizing those 5 practice-specific questions could be the ability to include effects of the COVID-19 pandemic. So currently, the verbiage for the template doesn't necessarily include anything regarding COVID-19. So with the ability to configure up to those 5 practice-defined questions, your practice could begin tracking any effects of the COVID-19 pandemic and what it has had on a patient and their health, allowing you to really consider all aspects of a patient and what can contribute to their overall health outcomes. So the spring 2021 release also allows the ability to run crystal reports to see different measures upon the implementation and use of the Prepare template. So to run those reports, you're going to navigate to File and then into Reports and Crystal Reports, and you can expand that all encounters for all patients. You can choose from which crystal report you would like to run from the list of 5, those of which including characterizations of population, outcome measures, process measures, utilization reports, and utilization result details, and you can export those as needed. One thing to note is that you might have to set up these reports to be run if they're not already showing up in your list of crystal reports. And to do that, it's going to be right there in the report window. You're just going to want to click on Report Setup. So as promised, we're going to take you through a few of the configuration options in that 6/21.1 or spring 2021 release Prepare template. So the first step is to check off Enable Practice-Defined Questions in the Practice Configuration System Practice template. So upon navigating to that file and selecting System Practice Template, under the Practice tab, you will then navigate into Practice Configuration, and that screen up on the right is going to appear. So that checkbox of Enable Practice-Defined Questions, you're going to want to make sure that is checked off. And that's what's going to allow you to create those 5 or up to those 5 practice-defined questions that we mentioned earlier. So once that setup has been complete in that practice configuration system practice template, you're then going to move on to the configuration of the actual practice-defined questions. So to configure those, same sort of process, click on File, and then select System Practice Template. Except for this time, you're going to want to navigate into the Practice tab and go into Prepare Configuration. Upon going at the bottom of the Prepare System Practice Template, you will see the ability to add up to those 5 practice-defined questions. So as we mentioned earlier, these are completely customizable to your practice and more specifically customizable to your patient population. These can be a great tool to capture anything that you believe would be beneficial in improving the health outcomes for your patients. There's also the ability to configure a score that's associated with each response on the template. And that interpretation for the total score is configurable as well. So this will indicate whether the patient is identified as high risk, low risk, or moderate risk for social determinants of health affecting their health outcomes. So now that we've kind of taken a look at the more back-end configuration side of things, let's take a look at how you will actually access that template from the EHR in the new spring release. So to access that prepare template, you're going to pull up a patient's chart, and perhaps you're opening from the intake template. There's going to be a purple arrow icon in the lower right corner, and that's going to open a navigation menu. You can select screening tools, and then under the screening tools menu, you're going to scroll down until you find prepare and click on prepare. So the prepare template is then going to open, and you're then going to be able to begin capturing the patient's social determinants of health by asking the patient the questions listed. So at the end of the template, there is a section for practice-defined questions, and this is where we're going to see those practice-defined questions in action. These are going to be what your practice has agreed upon implementing, and they're now going to show in the template to be asked. So you will notice there is a community resources link there towards the bottom. The community resources template enables providers to document local resources and supports recommended to the patient in aid in meeting the patient's psychosocial needs. There's also a referrals link, which is going to navigate that user to the referrals module where they can document any referral to perhaps an additional outside or community resource that may aid the patient as well. So after you've worked through the entirety of the template and you obtained the social determinants of health information from your patient, the prepare template documentation is now completed, and the user is going to be able to generate the actual prepared document, which is going to summarize the patient's social determinants of health as well as create that score interpretation. So there are some other tools that you may have access to that may assist in the collection of social determinants of health data, such as NextGen Analytics, NextGen Population Health, which to note, they have made the addition of the first 4 social determinants of health, and you're going to find those in the condition registry tool within the Inform module, those 4 being homelessness, inadequate housing, lack of adequate food, and unemployment. There are some intake softwares as well that may have predefined screeners that you can add to your intake process or that you might already be using, including Phreesia, Clearwave, and OTEC. So now that we've kind of taken an in-depth look during our phase 1 exploration into how you can begin the documentation of the social determinants of health data for your patients, let's talk about how you and your providers can become actionable on this data with our phase 2 discussion. So we know that social determinants of health as an initiative are incredibly complex. And really the question that comes to mind is how can we create a relationship from clinic to community? So again, the challenge is this. The situation is completely unique because this is a relatively newer initiative, and it's going to take action on the part of both the provider and the patient to go one step further from just collection of data. The provider is going to have to find a way to connect their patients to resources that are going to be able to impact their social health and provide it in a way that they can then go back and document that they did it so it's in the system and there is a record of it. So again, the question, who is that resource? Where do you find that tool? How do we make that connection from clinic to community? So the provider could approach a community organization, or an organization could approach them by saying something along the lines of, would you like to align with us in this journey so that we could have a telescopic view into what our collective impact would be on our community's health? So upon approval of that, there could be some sort of relationship formed between the provider and their practice and the community resource. But I understand a lot of you on the call today likely won't be rolling out that large or involved of an initiative right away. So there are options where you can locate community resources to inform and connect patients with versus forming some sort of relationship or partner. Good news for you is that there's already a tool that aggregates community organizations for clinicians looking to refer patients to these social services called Aunt Bertha. Aunt Bertha has the largest and most widely used social care network in the US, with over 1,300 resources in each and every county. Over the last decade, Aunt Bertha's network has grown to over 552,000 locations, and it's going to continue to increase daily. So their mission really is to support nonprofits and other healthcare organizations in serving the critical and essential needs of their communities. Providers can utilize Aunt Bertha to gain insights into the critical social and health needs that are most relevant to the community or communities in which they serve. Aunt Bertha can help providers be more prepared to provide quality care while also reducing associated costs. If you take a look at the current slide, you can see just how in-depth the program is in drilling down, even to the county, the different resources that are available by type. So findhelp.org is a great free resource provided by Aunt Bertha, again, free resource, in which providers can search by zip code to find free or reduced cost programs that can assist their patients based on whatever social determinants of health data was collected in their visit. So the referral to the community resource for the patient is the perfect start in creating that clinic to community relationship that we really emphasized earlier. So as a provider who may be using NextGen, it would be important to document a referral to an outside source. So if you remember from earlier, I mentioned that there was a referral link at the bottom of the prepare template. So that would be where you could utilize it for this exact purpose. So the provider is going to enter the details of that referral based on the information they acquired from Aunt Bertha or findhelp.org, and the referral would then be documented in the patient's chart. One thing to note is that once that referral has been completed, there is the requirement of a reconciliation process in order to kind of close the loop on that order. So the last question really becomes not if, but when will collecting data on social determinants of health be incorporated into your current workflows, and are you prepared? And no, not a typo. If you know me, you know I can never pass up a good pun. I think I get that from Lindsay, so I could not resist. So what are your next steps? Well, if you need any assistance with integrating social determinants of health into your practice, we do offer a clinical workflow analysis, which is a 3-day on-site fixed price consultation where we can assist you with this and much more. We also have revenue cycles and front office, as well as technology and performance consultations. So also please continue to sign up for our webinars and view our blog. And if you have any other needs outside of this, do not hesitate to visit our website and learn more about what we do and how we can help, including our add-on products. There are some new ones on there if you haven't checked it out in a while, so I encourage you to go and check that out. So, and finally, questions. We have our contact information up here on the screen if you have to jump off. And if you want to email us a question, feel free to do so. I am going to turn it over now to Chelsea to read out any questions that were put into the chat. But before I do, I really want to say thank you for staying on. So with that, Chelsea, feel free to start with questions.
Chelsea, I don't know if you're trying to talk, but I think you might be muted. And
uh-oh, I think we lost Chelsea.
That's okay. I have access to the questions as well, so I can go ahead and read through them. So the first question I saw come through chat, it says, social determinants of health is so broad and needs a lot of time and effort to improve patients' living conditions to help improve their health. How can health centers be able to help when they don't have the time and resources to do so? Appreciate that question coming through. That is very valid. I do think that came through more towards the beginning of the presentation. I do hope our kind of last section on here of actually how to make an impact on patients' health when you don't have, the big institution behind you or large financial resources or even extra staffing resources. I would say our answer to that to make that impact is to utilize what you already have. At minimum, just start collecting the data from patients on SDoH. Use that prepare template that's already likely in your system out of the box, or a resource that you already have at your practice, like those intake softwares. I know they have pre-built templates to collect that data. At minimum, start there. But if you can take it a step further, if your providers or whoever checks the patient out could go online to that findhelp.org and look and address whatever insecurity they were having with the social determinant of health, and use that website to locate something locally to just give them that information. That's what we tried to do today, was really give you guys on the call here, an option to truly start this program without trying to add on, extra staffing or, a lot of financial resources, because I know a lot of people don't have that to get this started. So I hope later on in the presentation that answered your question of how to actually implement this and what free resources you likely already have to start making an impact, or at least trying.
Great, thank you, Lindsay. Moving on to the next question. It looks like this is a comment. Aunt Bertha was replaced by Buckeye Community Health.
I can comment on that too. Aunt Bertha still exists, it's still around. Buckeye Community Health is specific to Ohio. So that's a great point though, I will say. I know Aunt Bertha is nationwide, but likely there are state-specific programs that mimic Aunt Bertha in a certain way, and likely are maybe even a bit more granular or updated more frequently. So I would encourage everyone on the call to try and research their state-specific websites for community resources for SDoH.
Okay, great. Moving on to another question here. Is the prepare template bidirectional, meaning is there duplicate data on the social SHX template? Does the data override the resource?
That is going to be a Lexi question.
Lexi,
if she
are you
is
able
still
to
on.
confirm on that one? She is on. She might be muted. Actually, I think that she is going to be on with us in just a second, so we're going to take another question and circle back to that one. You mentioned for anyone 593 or higher, the prepare template is an out-of-the-box feature. What about clients who are on 592 or lower?
Yeah, I can snag that one. Yeah, I just kind of made the assumption that everyone was on 593. Shame on me. So for install and support requests for the TCS version of that prepare template that's going to be available for anybody on 592 or lower, you're going to want to open a support case with the product category of consulting products and services and the topic of technical consulting services. So make sure that that case subject and description are going to identify prepare as the issue. And that should get you set up with that prepare template.
Great, thank you, Holland. Next question here. Have the prepare screenings been standardized to reflect the risk stratification appropriately? Lexi, do you want to take that one?
Yes, I can grab that one. So yeah, the scoring for that prepare template, it is standardized. So it does come when you install those templates in your system, they're going to be pre-installed. And those values come from the National Association of Community Health Centers, or NACHC. So definitely standardized, but then there is also the ability on that system practice template that Holland was showing you previously, that you can go in and you can modify some of that scoring. So some things like the minimum and maximum total scoring, things like that, the interpretation. So there is some flexibility as well at the practice level to modify that if needed. But it does come as a standardized set initially.
Okay, thanks, Lexi. Next question. How long does it typically take to answer the prepare tool? Our provider have 15-minute visits and we're getting some pushback about implementation. It's a good question.
I can hop in here too. I mean, it is a little bit of a lengthy screener. I know we had an example up on there before. And Lexi, you can comment on this, but I do feel like a lot of our clients have this screening happening, like the patient's filling it out either prior to their visit on the patient portal, or even possibly part of their intake, and then they're reviewing it within that visit. So it does go a lot faster. Lexi, have you seen anything else or any other best practices?
Yeah, I would definitely agree that, I mean, it would take, a couple of minutes for the patient to complete the questionnaire, which I understand, if you just have 15 minutes total, then even, 3 or 4 minutes is a dent in that time with the provider. So I would say, yeah, I understand with certain populations, the ability to, utilize the portal or get that, questionnaire ahead of time might be difficult, but I know we've definitely seen groups who they additionally might have you can have like tablets in the waiting room. So even, if a patient can electronically fill that out, while they're waiting is another way, can maybe get around, having that, complete that information, or, as Lindsay mentioned, if you do have a portal, or, the ability to send that form ahead of time, that's an option as well. So yeah, I understand the concern with that, but yeah, if you could find ways to maybe get them to do that before, to not cut in time with the provider. The ways that we've seen.
I do know one of our clients too, even doing this, they have it in the room available for the patient to fill out while they wait for the provider once they're already roomed when they're coming in the room. So that's another option too to consider workflow-wise.
Okay, some great ideas. Thank you, ladies. Next question. Are there other ways to access the prepare template other than having to navigate through the screening tools on the spring release?
I'll take that one. Good question. Yeah, so we only utilized that screening tools aspect on the spring 2021 release. But yes, you can access it via that link from the histories template and the social history panels, just as you would in the previous version. That functionality is going to transfer over.
Okay, perfect. So I think that we're through the questions. So I'm going to circle back to that one that we promised to come back to. Is the prepare template bidirectional? Meaning, is there duplicate data on the social history template? Does the data override the resource?
Yeah, so Chelsea, I can take that one as well. So the first part of that question is the prepare template bidirectional. That would depend on your version. So I know as Helen kind of mentioned during her portion that there is, certain versions where with the NextMD portal. So, for those of you, if you're thinking about, future spring release in the PXP portal, just keep in mind, I'm talking about the existing legacy NextMD portal, the ability to be able to send that form as a web form, and then it would be received back, and that data would actually be discrete data, which essentially just means it can go directly, fill into the system and fill in that data. Currently with the PXP portal, there is not an option to send that out and receive that information as discrete data. And again, I'm just talking current state. I know they're constantly working on that portal and, bringing out new features. So I could definitely see this as something happening in the future, but currently your option, if you did want to, get that information out there ahead of time, would be to send out that form to the patient. They would fill it out and return it electronically. The difference currently between the PXP portal and NextMD is that information would come back as a PDF. So essentially you'd receive that PDF, it would show in the patient's chart under the encounter. You'd be able to see that information. It would just require then the kind of slight difference as of now is you'd have to manually enter that data. So you're still getting it ahead of time. You're still saving the patient's time of filling it out, not having to take time away from you actually seeing the provider. But that is just a slight difference between the versions, depending on, if you are currently, on a version prior to 6/2021.1, and so you still have the NextMD portal, or if your practice has moved forward with PXP portal or you're considering it. So just so you guys are aware of that kind of difference.
Okay, great. Well, it looks like that's all the questions that we've received. If you think of any questions afterwards, or if you were scared to ask your question, you see both Lindsay's and Helen's information up on the screen. Feel free to reach out to them directly. Otherwise, you can always reply back to the email that I'll be sending later this week with a link to the slides and recording. Basically, any way you can get a hold of us, we're happy to help. That's why we're here. We hope that this webinar was beneficial for you today, and truly ask us questions if you think of them. That's why we're here. We enjoy that. So thank you all for joining us today, and I hope that we see you at our next webinars as well.
Yes, thank you, everyone. Have a great day.
Thank you.